Team Potato Party has been working on state of you, the state of your health. And that has to do with electronic health records using the blockchain. So we found out that accordingly, electronic health records where your information is saved should be fast, reliable, and secure, and for the past decade or more, it has not been at all. So we found a couple of problems. The first question, what is one of the largest causes of death? And we found out is misinformation. People getting the wrong information about how to be treated and what to give to them. And we sent out a couple of questions and surveys in Twitter, got a bunch of responses, and guess what? People are still using paper to document their health records and not using enough electronic resources or a mixture of both. They don't have, and medical professionals don't have a way to effectively reach this data or synchronize it where it's coming from. We also sent out a survey in there and got some responses on medical records and how to access it. And conclusions, what problems we found out, people have problems with ownership. They don't own the information. They don't know who has it or who produces it. Access, who has access to this information? Permissions, are they allowed to? Can they get my medical information? What are they using it for? And standard and interoperability. There's not a common language for them to communicate to each other on this information. We developed a couple of personas. Personas are people like you and me. Patients, the nurses, the emergency vehicles, the emergency service providers, specialists, insurance companies have no way to access this information where you're having an emergency. Government and regulatory agencies should have it. And guess what? IT providers also need a way how to work this information to make it available to all of these people. So our mission is a way to create something for health practitioners around the world to manage and synchronize all of this information while also giving you, the people, the ownership of it and who gets access to it. So if you travel around, anybody in Prague or anywhere else will be able to treat you and treat you correctly. Now, they're standardized in a common language. A lot of people have come up with several ideas, but the one that we found and the one that we've used the basis for is the one that created by the Standard Health Record Collaborative. They've made an open source project
on data structure,
on data structure and what the data structure, what information do we want, how do we make it out there. And that's the one that we've used as a basis to make sure that we have a same language for all of these personas.
Which is in the end a huge JSON file.
Exactly. So there's tools out there that want to do this as well. There's patient theory, there's Coral Health, there's medical change, but guess what? One of them only focuses on the user kind of putting their wellness information. The other one, Coral Health, is more about giving personalized services to these people. And the last one is more catered to insurance companies, which is always, something tricky out there. They don't cover as much as we want to cover with our tool. So our playing factors, when we try to gather all of this information, we make a sitemap with the people. What information do they need access to? How do they want to put in that information there? We created wireframes to, define the flow. And then we started developing things, and that's when Benjamin and Andy made their genius things.
So we started to build a prototype using BigchainDB, which is an online service which focusing on providing access to the blockchain, but for storing data, not for payment, right? So we'll do a quick demo of what we've done first. All right, so in our prototype, we wanted to store simple strings in the blockchain. So first you create your own identity in the blockchain. So you enter a password that's generating a key here. That key here is your identity in the blockchain. From there you can access your records, which at the moment are only strings of text. You can add new records. They are stored on the blockchain for real. They have an ID here in the blockchain. This is working really. You can see you can actually trace and see everything stored in the blockchain from there. Those records, they belong to you, so you can see your records, and then you can see all records that we stored in the system. So that was our quick proof of concept, just to get more familiar with the technology, basically. And after this, we've been able to build our final product, which is a progressive web app, so still using BigchainDB. We had to use an NPM package, which is an ORM, so an extra layer on top of it, which allowed us to access the DB. It didn't work initially, we had to tweak it. Then using Angular as the main, the core platform for the app, the core technology for the app. And I will leave Andy go through the demo.
So we basically built the login and registration system to interact with blockchain to push and pull the data. We built two administration areas, the individual and the professional one. So professional area, we done the dashboard, and we built all the different sections to basically work with all the data. We built the dashboard area with a few graphs and stuff. We built conditions, which shows kind of medical history for the user, all the kind of drugs, appointments, different things they're dealing with.
And that's okay.
That's it.
Good.
Good.